Welcome to the Pediatric Intensive Care Unit at Children's National Medical Center, sometimes referred to as the PICU. You know your child best, so we want you to participate in what we call family-centered rounds. Imagine that rounds represent key points along your child's healing journey. We want you on that trip with us. Rounds take place twice a day, morning and evening. On rounds, our team travels through the unit, stopping at each room to assess and discuss each patient's care. Each team member is given uninterrupted time to speak and ask questions, including you, the parent or guardian. Everyone at Children's National values your participation as much or as little as you are comfortable with. So what should you expect during PICU rounds? First, we do an overview to gather a complete picture of how your child is doing. We also discuss the plan for the day or night. You'll probably hear medical terms new to you. We'll do our best to explain them. You can also ask your nurse or a physician to discuss them with you later. At the end of rounds, we'll ask for your input. This is a great time to raise questions, concerns, observations, or anything else on your mind. So who is on the rounds team? There are 5 key players: resident, fellow, nurse, attending, and a parent or guardian. A resident is a doctor in training who can answer your questions about things like the timing of tests and results. A fellow is a senior doctor who supervises the resident and helps make the plan for the day. The nurse is responsible for the bedside care of your child. The nurse can be your representative to communicate for you if you can't attend rounds. Your nurse will get to know you and your child quite well and is a great advocate for you. The attending is the leader of your child's care team. If your child had surgery, the attending will discuss your child's care with the surgical attending and his or her team. Together, they will determine the plan of the day. Sometimes other medical team members join rounds, such as specialists and respiratory therapists. Everyone plays an important role. But don't worry if you only know the 5 principal members of your team. So how can you participate best in rounds? Try the 3 Ps. Be prepared. The ICU can be a busy place. It's easy to forget something you wanted to discuss. Try to write things down when you think of them during rounds and throughout the day, and bring them to the next rounds. Be present. This is a difficult and emotional time. Just being present on rounds can help you feel reassured and part of the team. If you can't attend, that is okay too. We'll be sure you still understand the plan for the day. You can call your nurse anytime and can always ask to speak to the doctor. Be patient. Healing takes time. There are many people involved in your child's care. The team is moving as quickly as we can. Always remember to take care of yourself too. Your child needs you to be strong. At Children's National, every member of our team cares about your child and about you. Participating in rounds is a way you can directly contribute to your child's care. Welcome to our rounds team.